Well, health officials are raising concern as measles outbreaks spread across the United States. The Centers for Disease Control and Prevention reports more than 900 confirmed cases already this year, just weeks into 2026. Now, that includes 5 new statewide outbreaks in less than 2 months. To put that into perspective, there were about 2,300 confirmed cases reported in all of 2025. So joining me now to tell us more is Dr. Steve Goldberg, Chief Medical Officer of Diagnostics at HealthTrack RX. Dr. Goldberg, good morning. How are you?
Good to be with you, Cornelia.
It's good to have you. So again, we were talking about those numbers. We're only just a couple of weeks into the year, and we're already seeing more than 900 confirmed cases. How concerning is that pace compared to what we saw in previous years?
It's almost half in a quarter of the year of what we had the entire year last year. So it's not good news.
Yeah.
We've got outbreaks in 24 states, the largest in South Carolina and Florida. And there are some good strategies to take. We just need to take them.
And so one of the things I think is really interesting about this is that measles was actually declared eliminated back in 2000, almost 2 decades ago. What has changed that is now allowing outbreaks to kind of reemerge?
It's lack of compliance with immunization recommendations from the CDC. Mm-hmm. So what we need is all children to get the 2 measles vaccine before they enter kindergarten. And if adults have any concern about their immunization status, to go check or go get a vaccine. And then if you think you might be ill with measles, there are certain features of it: fever, runny eyes, runny nose, sore throat, body aches, maybe respiratory problems. And then finally the rash. Go get evaluated in urgent care and the ER. But if you can, call before going and wear a mask before you check in.
And Dr. Goldberg, when we talk about going and getting that early diagnosis, how do overnight diagnostic labs help contain the virus more quickly?
Well, we're the nation's leader in outpatient infectious disease testing. And we have a large lab in Louisville, Kentucky. All samples from anywhere in the continental United States get picked up, flown to our lab, and resulted out the next day. That allows clinicians to be able to give really good guidance to folks who are presenting with complaints, so they can help tell the difference between a general rash and a measles rash, get them the right counseling. And if they have measles and are getting worse, then potentially refer them appropriately to a hospital or other.
Got it. Now, this is something that I also didn't realize, as many people don't realize as well, but measles can linger in the air for up to 2 hours. How can that impact public exposure risk?
Measles is the highest spreading virus that we confront in modern U.S. Mm-hmm. It can linger in the air, it can linger on surfaces, and if someone has the infection and encounter someone that's not immunized, it's very likely that person is going to get the infection. So we need to do the precautionary measures, which are: first, go get vaccinated. Second, if you think you might have the illness, get appropriately evaluated and diagnosed with rapid testing. And then third, if you have any question about your immunization status, just go get a vaccine.
And what about the people who may potentially think that they do have it? What are the most common symptoms that they should watch out for?
I would say if you have general illness with a rash, that in today's environment prompts a good reason to go get an urgent care evaluation or an ER evaluation. And if you have the time, call ahead and then wear a mask when you enter the facility.
And then for communities that are currently experiencing cases, which you said 24 states that are having outbreaks right now, what immediate steps should families and schools take?
Well, the first is to evaluate within your family if folks have been immunized. We probably have hundreds of thousands of children that haven't gotten the 2-dose vaccine before they've entered kindergarten. Yeah. Possibly we have some adults that are not immunized. So if you are not immunized, then getting the vaccine, it's safe and highly effective. It's 97% effective. Then what we have to do in our communities is elevate the immunization rate of the community. And in the United States, we've dropped. if we have 95% immunized in a community, it just won't spread. Right now, overall nationally, we're about at 93%, but that 2% difference is why we're having these outbreaks.
And how is there an age limit? Is someone too young? At what age should parents try to get their child that vaccine?
Well, there's a schedule for 2 pediatric doses before entering kindergarten. And parents can check with their pediatrician or the CDC for the specific timeline for the 2-dose regimen.
And then into our adulthood, will it continue to last, or do we need to get updated on those shots as adults?
You know, that's a great question. If you've been immunized, even a single vaccine, which was the rule up until 1989, the CDC says you're covered, and that's great news. But if you are in an environment where there's an outbreak and you think you're at higher risk, or you might be working with children, or you're in a healthcare environment, talk with your clinician about getting a booster.
Got it. Well, Dr. Stephen Goldberg, we appreciate your time this morning for coming on and letting us know about the measles outbreak and how people can take steps today to start protecting themselves and their health. So we appreciate your time this morning.
My pleasure. Have a great day.
You too.
Hi, I'm Rochelle Murcia with Eyewitness News Bakersfield Now on YouTube. Thank you for checking out our YouTube channel where we have tons of great content to choose from. While you're here, go ahead and click on the subscribe button right there. That way you can stay up to date on all the things related within Kern County. Thanks for watching.